I wanted to start by just discussing what inspires you about palliative and end-of-life care. And I know that one of the heroes we have in common is Dame Cicely Saunders. Can you tell us about that?
I think that there's the quote that really stays at the forefront of my mind whenever I'm dealing with somebody around end of life is how somebody dies remains in the memory of all of those that live on. And I think it is so important that we can make sure somebody has a positive experience at the end of life, because for relatives and carers, they are left with that memory.
I'm going to ask you about what kind of engagement this group has. Who's round the table, for example, at this task force?
It's really good to know that actually more people wanted to be involved than we could actually physically fit in terms of organisations. But we have providers such as UHL and LPT and consultants from those areas. We also have GPs. And primary care. We've got commissioning colleagues, and also very importantly we've got DHU and EMAS as well, along with Lauros and Marie Curie. So all the key players are involved. And one of the main drivers and main deliverables that the task force needs to achieve is to bring all the best practice from all the organisations together and to make it seamless for patients. Some of the key things that have come out are around understanding exactly what the offer from primary care and GPs is, and also make sure that we have quality standards that each GP practice and primary care network can work towards, so that whether you are in North Leicestershire, the city centre or Rutland, you know that you will get the same level and the same standard of care and understand what is expected and what you should expect as a patient and family member to actually receive.
About what are the priorities for GPs? What can they do now? I would say one is identifying patients. So if somebody's got a serious illness or a diagnosis, they're not getting better, they're having repeated unplanned admissions, ask yourself the surprise question. Would I be surprised if this person were to die in the next 6 or 12 months?
Yes.
Could this person be in the last years of their life? And I think that triggers the whole process of care planning, sharing information and coordination.
We are providing and developing an integrated palliative care team. So there have been really good services within Lauros, LPT and Marie Curie that have provided care for palliative and end-of-life patients. What we are doing is bringing all those services together via a coordination hub, which will help both primary care and secondary care colleagues. When they have somebody that has been identified as end of life, there will be one place, one phone number that people can ring, and they will be able to discharge patients into the care of the integrated team, knowing with confidence that there will be a wraparound service provided to meet the individual needs of that patient in their home environment.
What are the plans in LLR to standardise care planning, and what can we expect?
I think we can expect a lot more standardisation. There is the national initiative and mandate about introducing respect, and there's been a great deal of work going on around that. So that will provide the opportunity to standardise a summary of care plans for patients, whether it is in secondary or in primary care, and will allow increased coordination and communication and information sharing.
So just to summarise, Carole, the work of the task force is about supporting GPs and nurses and consultants to provide great care.
Yes.
To identify patients early.
It is.
To give a good service in the community that's responsive and integrated.
Yeah.
And also through a formal system of care planning called Respect. And I know that we're working on plans to support everyone to do this through training and education. We'll be doing more podcasts and I look forward to working with you on that and to the next meeting of the task force.
Indeed, and likewise.